Welcome back to Life in Review. I'm Josefa Salinas, your host. Well, as the nation is dealing with this historic pandemic, we got to think about a whole lot of side effects and other things that people might be putting off, like going to the doctor, or when they're feeling something that's not quite normal, but they don't want to go to the emergency room because they're afraid of running into COVID. So many situations are happening that we got to talk about today. We're talking about getting ahead of stroke. It's a campaign that is warning Americans about the risk of disability or even death if you ignore symptoms of stroke or postpone calling 911. With us this morning to talk about it, Dr. Mack, President-elect, University of Southern California, Los Angeles. We are here to talk about it. Good morning, Dr. Mack.
Good morning. Thank you for having me.
Oh, it's wonderful to have you here. Let's get right down to it, Dr. Mack. Every 40 seconds, somebody in the United States has a stroke. 20% of them die from the condition. Many more are left permanently disabled. I know my mom's had a couple of strokes. She recently had a TIA, which is kind of like, what is it, a mini stroke or something?
That's right,
like that?
a transient, a stroke that doesn't last for very long.
Yeah, so let's talk a little bit about the symptoms of a stroke and then some of the things that are going on in life right now that could be leading us down the road to a possibility of a stroke.
Yeah, so the symptoms, so stroke is, as you said, a really important and a really catastrophic and deadly disease when it strikes. And the problem is it often strikes without pain. So it's very different from a heart attack. People recognize that there's something wrong with them, but they don't feel immediate pain, and they don't know how urgent the situation is. There's a lot of mnemonics and a lot of abbreviations that people can follow to look for symptoms of stroke. One of the easiest ones is the FAST, F-A-S-T. It talks about a facial droop, meaning if the face is not working properly, or if there's weakness in the arm or the or arm or leg, or speech difficulties. Those are obviously very concerning symptoms for a stroke. They can come from other medical pathologies, but stroke is probably the most concerning of those, and certainly one of the most reversible. The last T is time, because time is of the essence in these cases. So it's really important to get evaluated, get to the hospital, call 911 when you have any of these symptoms that are concerning for a stroke.
Why is time so important when you're dealing with a stroke? I think that's something people really need to understand.
Yeah, as I said, it's difficult when you don't feel that emergent pain, but time is super important because millions of brain cells die for every minute that a blood vessel is blocked. And that used to be an inevitable fate that we couldn't do anything about, but now we have ways of opening these blood vessels. And as soon as we restore blood flow to the brain, those brain cells can get oxygen and breathe again. So the amount of time that the blood vessel is blocked by the stroke is directly related to how well the patient does or doesn't do. So the faster we can get that blood vessel open and get more blood up to the brain, the better off a patient's going to be.
Is there anything that somebody could do at home to help the person while they're waiting for an ambulance, which doesn't always come really fast?
Yeah, so the most important thing to do is to get the ambulance and get the paramedics there, because there's certain things that the first responders can do to figure out if it's likely a stroke or if it's not likely a stroke, and to get those patients or individuals to the right place, the right hospital the first time. Aspirin is something that helps people both in stroke prevention and stroke treatment. So that's something that patients can be on or taking at home. But the critical step is just to notify the paramedics and the emergency services to get that patient to the treatment center that they need.
Is there a particular age that a stroke will affect? 'Cause I know some people think, oh, it's just for old people, but younger and younger people are having strokes now.
Yeah, so you mentioned that we're talking about the COVID pandemic. There's been a lot of data to show that younger and younger patients are having strokes. We typically see strokes of all age, everything from young people to old people, but it's certainly much more heavily weighted towards the elderly population. However, during this COVID pandemic, that age has shifted, and there's a number of young patients in their 30s, 40s, 50s that we've seen presenting with the worst kinds of strokes, the large vessel blockages that cause the strokes. So it's really become a disease of all ages.
Is there anything that we're doing in our lifestyles that are leading us towards a stroke that we could try to correct?
Well, there's certainly many risk factors over time that lead us towards stroke, whether that could be lack of exercise, smoking, diet. Those are exercise and proper diet and no smoking are clear indicators that a patient has less of a risk for stroke. We can't prevent them. There are many other non-modifiable risks that could cause stroke. And just because you eat healthy and smoke and don't smoke and do exercise does not mean that symptoms that seem like a stroke wouldn't be. Those people are also certainly susceptible, but there are a lot of modifiable things that one can do to help decrease the risk of stroke or prevent that in the future.
Now, if you have had a stroke, tell me the difference between a TIA and then a full-on stroke.
Yeah, so the definitions have changed over time, but where we've arrived at now is a TIA, or transient ischemic attack, is stroke-like symptoms that haven't done any permanent damage to the brain. So they are reversible. They come and they go. Maybe it's because a blood vessel got blocked and opened up on its own, or maybe it's because the blood has just not gotten to the brain over a certain amount of time as much as it should because there's a partial blockage of a blood vessel. A stroke, on the other hand, is something that has done permanent damage to the brain that we can see on our imaging studies, our MRIs. Now, those are permanent and they stay there and aren't completely reversible. The symptoms can be reversible, but the stroke damage to the brain cells is there. So the difference people usually describe between a TIA and a stroke is the time course, how long it lasts.
And let's talk a little bit about recovery. How important is getting someone into recovery?
So there's two really important things about recovery. A lot of times the potential for recovery is determined at the very beginning of the stroke, how quickly the patient gets into the hospital, and as I mentioned before, how quickly that blood vessel gets open. So in these COVID times, if we wait and we go into the hospital several hours later, our recovery is going to be worse because more brain cells have been affected. Once a procedure or a medication has been done or once a blood vessel is opened, then recovery becomes very important, both in terms of rehabilitation, physical therapy, occupational therapy. These things can help stroke victims significantly. The recovery is not done when they leave the hospital, several days or a week after their stroke. It's done over the course of months.
Is there a website where people can go for more information and learn more about this Get Ahead of a Stroke campaign, where we're encouraging people, if you've got some of these symptoms, don't wait to go to the doctor. If you're feeling off, because if you've had the flu or you've had COVID, or maybe you had COVID and didn't even know you had it, the after effects can stay with you for up to a year. Am I right, doctor?
Yeah, the after effects. Stroke is a very serious disease which can harm you permanently. And as I said, sometimes the difference between life and death or permanent disability and temporary disability is the time and that initial step that the family takes to bring their relative or loved one into the hospital. You asked about the Get Ahead of Stroke campaign, and a lot can be learned on the internet from multiple sites, but the site getaheadofstroke.org is the site at which the Get Ahead of Stroke campaign is posted, and there's information on everything from the procedures to recognition to state policies to stroke in the time of COVID-19, support groups. So there's a lot of resources there on that website, and that's a great place to go for comprehensive understanding of these situations.
Well, thank you so much for being with us this morning, Dr. Mack, and I just encourage the audience. This is very difficult times that we are living in. There are so many of us that, you may have had the flu, you may have had COVID, your immune system is weakened, your body is weakened. Pay attention to your body. It usually tells you what it needs if you'll listen. Dr. Mack, thank you so much for being with us, and please come back and see us anytime you have more to share.
Thank you so much for having me. It was wonderful.
Have a great day.
You too.
If you are like me, you love dogs. I've had dogs in my life, my entire life. In fact, I have 3 German Shepherds right now. They're amazing, and they're all at different ages, too. I got them from rescue. and they are at different ages. And I often wonder when I look at my dogs, like my oldest, she was allegedly about 2.5 when I got her. They weren't quite sure. But she already has this gray muzzle. And I started thinking, she's got to be older than I think she is because she's got this gray muzzle. Or do dogs age faster than we think they do? Or are we this whole, one human year to 7 dog years? Is that really what it is for dogs? Dr. Chad Dodd, he's a consulting veterinarian for You Move, and he is with us this morning to talk about our dogs. Are they older than we think, Dr. Dodd?
Yeah, good morning. There's some latest research out now that actually is giving us some hints that, they might actually age faster than we thought. The old adage used to be that, 1 dog year was more like 7 years in people. There's some new research that's come out from one of the University of California, San Diego research teams. And what they're finding is that 1-year-old dog might actually be more equivalent to a 30-year-old person. So it kind of makes us, reset a little bit and think about, the German Shepherd with the graying muzzle, like your dog, when is that happening? Is that happening in their sort of midlife? Is it happening earlier than maybe we thought? Those are all questions now that this new research actually sheds light on. And it's something we have to try and figure out. And it's interesting because, we get this question a lot about, well, when should I consider my dog to be an adult? Or when should I consider my dog to be a senior? And oftentimes, from nutrition companies and others, we've always tried to say, well, they're puppies up to this certain point in age, and that might be between 9 months and a year. Well, what's actually happening in that time frame from 9 months to a year of their life? If it's true that they're more like a 30-year-old person, there's a lot of changes that happened in their life. So as a veterinarian, as a pet owner, we want to be thinking about ways that we might intervene and do things differently now that we know they're aging a little bit faster.
Yeah, one of the things I noticed, now I know German Shepherds can be, they tend to, put it this way, have hip problems. Now I have 2 German Shepherds that one of them is called, I think it's a giant German Shepherd because he's the biggest German Shepherd I've ever seen in my life. I had no idea that this dog was going to be this big. I got him at 8 weeks old, and he is 160 pounds. He is
And just
huge.
A big teddy bear, right?
Oh, he's huge. Yeah, Jack is amazing. And the other one is as tall as Jack, but not as thick. And then Angel's like a normal-sized German Shepherd. But she doesn't like to go up the stairs at night. It's like she goes really, really slow. And the other 2 will just bound up the stairs. Now, they are younger than her. And they're the bigger dogs and heavier dogs. But they just bound up the stairs. They chase balls. And she's just, not really. She just wants to kind of lay around. She'd prefer to be in the house, not outside. But she really goes slow up the stairs and can't jump up on the bed. The great big huge German Shepherd can jump right up on the bed if he wants to, but she can't jump up on the bed. So how do you know when they're having hip problems? How do you know when your dog might be hurting even though they're not crying?
Yeah, so that's a great question, and that's a really common question that dog owners of dogs of all sizes, they ask that question, right? Because they wonder, is this something where maybe my dog is getting a little bit older, slowing down a little bit, but what are those signs to look for? You've picked up probably one of the more common ones where maybe in the past the dog was able to go up and down stairs fluidly, was no problem. Now they're hesitant. Sometimes dogs that maybe hop up at the edge of the bed and they just lay there for a little bit. They can't get up on the bed. Maybe hopping in and out of the car seems to be a little bit more challenging for them. And also dogs that maybe don't do that, like maybe they're not used to jumping on things, or maybe you don't have stairs. But watch your dog when they're getting up from a rising or resting position. So like they're actually standing up from their bed or wherever they normally lay. Just watch them and see, is that kind of a fluid movement? Or is it something that maybe is a little, they're hesitant to do something? Or if you're used to taking them on walks and you haven't changed that routine, if it seems like they're maybe tiring a little bit, or maybe they're not able to go as far as they could before, this is a great time then. If you see that, it's a great time to consult with your veterinarian because they can help you determine, is that something you should be concerned about? And most importantly, if they are starting to show signs of aging, what can you do to intervene? And this is really where there's a lot of options for pet owners on things you can do to help your dogs if you start to see these signs. And there's actually products that will help slow down that process. So, nutraceutical products, pain management products, therapeutic foods, there's an assortment of things that can be utilized, but your veterinarian really is the best person to help figure out, is this normal for your dog, or should there be something we might want to do to intervene to help them? Because what you want to do as a pet owner is keep that quality of life going. And there's little things we can do daily to try and help in that process.
So let's say that my dog's about maybe 6 years old. And it says, I think the researchers say that would be equivalent to about 60 human years. But
That's correct.
Is a 60-year-old human years, is that, I mean, you think of somebody at 60 like really not being able to move as fast as somebody 20. Is that the same for dogs? Like, what is an old dog compared to an old person?
Yeah, the old adage, you can teach an old dog new tricks, right?
Right.
Well, I think it just comes back to, there is a personal sort of individual aspect of all of this. Interesting for you, you have 3 German Shepherds. They might have a common sort of breed element, but they might have different personalities, different size, structure. They may have different habits. But just like in people, my maternal grandmother, she lived to be 98, and she was very active up until the point that she passed away. But I know people that are in their 60s and 70s that struggle going on a walk, and a lot of that has to do with, how do they maintain their life, good quality nutrition, exercise, routine exercise, keeping your weight in check. These are all things that also apply to our pets. And what this new research is showing us is that this model now of looking at ways dogs age, it could actually translate and help understand things in human health as well as in dog health. Which is really interesting because there's a kind of a fascinating science space around this thing they call One Health, where we do learn from different species on things that might apply to, helping our own health, or in some instances may actually help our pets' health. So once again, these are areas where I really encourage folks to build a strong relationship with your local veterinarian, because they can help you identify where your pet is in this sort of general cascade of health. And hopefully, we can do things to try and intervene so that if their average lifespan is, 11, 12 years of age, can we extend that maybe another 10 or 20%? It's likely if we can do things like this early intervention, I think there's opportunities for us to definitely improve that.
Now, some of this genetic research in dogs, it shows that puppies and younger dogs, like they age at a faster pace when they're young. And so that might make sense, because I know so many people say, yeah, my dog is crazy. It's a puppy, running around chewing everything up and, snipping at people and barking all the time and running around. And then when they hit about 2, they tend to, act a little bit better. And then by 3, we think we've trained them to somehow stop chewing things up and stop running around being crazy. But it seems like, according to this genetic research, it could be that they're just aging faster when they're younger. And so that when they're actually between 2 and 3, they're a little bit older than we think they are.
Yeah, that's right. So if you use the data that they shared in this research, they kind of made the equivalent of that the 1-year-old dog is equivalent to a 30-year-old person. And think about all the silly things we do from the time we're a juvenile to the time we're an adolescent to the time we're now considered an adult for people. We probably do some foolish things. We probably, get ourselves in some trouble. We may be more active when we're younger. But when you get into those 30s, you start to feel changes, right? Things just don't seem to work like they did when you were in your teens or 20s. Well, if dogs are doing that at the year of 1 year of age, and then say they're 2 or 3, this study was actually done on Labrador retrievers. And if you know folks that have retrievers, a lot of them will tell you, it kind of takes about 2 years to get them out of their quote unquote puppyhood stage, just based on the way they behave and their activity level. Well, this data would probably support that, because it actually shows that they may be aging a little bit faster. And once again, this is where if that really is the case, there's things that we can be doing to help our dogs to try and maybe delay the onset of some of these. You mentioned, the concern around arthritis or hip problems in dogs. That's a very common concern a lot of pet owners have. And the great thing is you can intervene as a pet owner, and you can give them things like nutritional supplements. So there's a lot of joint health supplements on the market. I recommend you work with your local veterinarian to figure out which one's best for your pet. I happen to work with a group that makes You Move, and they make a product that's really high in omega-3 fatty acids. And how do they do that? Well, it's about quality ingredients, clinically testing everything. But these products are really they're proving out to where they're providing the right environment within the body to try and prevent some of those things from happening or delaying the onset of these disease conditions, because it is part of the natural aging process. And what we want to try and do is do things that we can help either slow that down or in some cases maybe even prevent the onset from happening.
Yeah, because you want your dog to be around, as long as possible. I know I want mine to be around as long as possible. And
you want them to be active and
Yeah.
healthy, and you want them to do things and interact with you, right? The human-animal bond is so strong, and we're seeing that more and more these days, right? We're all spending more time with our pets. I think the dogs are enjoying it. Some folks would argue the cats may be a little concerned that we're spending too much time at home, but
Right.
It is one of those things. We want to. It's sort of that extension of the bond, right? We want to do things to keep our pets as healthy as possible for as long as possible, and that includes all these things that we're talking about.
Yeah, and I like the idea of an all-natural joint supplement. I might have to get that for Angel and see if I can't get my little homegirl to, bounce up the steps a little more. Because every night I'm like, Angel, you want a written invitation to come upstairs? Come on. I got to go downstairs, get her, because she has a beanbag chair that she sits in downstairs. So I have to get her off the beanbag chair, get her to the bottom of the steps, and then nudge her. And she turns around and looks at me every night, the same look. And then she, meanders up the stairs. So if there's a way to maybe make her little joints feel a little bit better, especially something all natural, because I don't like giving dogs a lot of chemicals. So an all natural joint supplement sounds like a pretty good idea. So thank you so much for being with us this morning. It's really cool information, because we've all been led to believe, 1 year, 1 human year equals 7 dog years. But it seems like a 12-year-old dog is about the age of a 70-year-old human. So that kind of makes sense that your dog eventually starts to slow down a little bit. And no, you didn't magically train your dog at 2 years to all of a sudden stop chewing stuff. He just got older, and you just didn't realize that the dog actually got older and probably decided they just didn't feel like chewing stuff anymore. Dr. Dodd, is there a website where people can go for more information?
Yes, I would encourage folks to go to youmove.com. That's YUMOVE.com. There's a lot of great tips, healthcare tips, things to do, things to ask your vet about, but a great resource just as a pet owner to have an additional resource for you to try and do everything possible to keep your pet healthy and happy and active through life.
Well, thank you so much for being with us this morning and giving me some new information about my dogs. I'm going to look at them all a little bit differently now and maybe try to help them out just a little bit more, a little bit faster. Thank you so much.
That's right. Thank you. You have a great day.
You too.
Take care.
Bye-bye. If you love baseball, you're going to want to stick around for this next segment. All kinds of fun facts you never knew, and it's all coming up next.